Hello, everyone. My name is Michaela Moody, and I'm a PhD student at UConn, and I'll be talking about my project titled The Skeletal Response to Varied Models of Metabolic Acidosis. pH homeostasis is very important to be maintained within the body, and it is achieved by the kidneys excreting hydrogen ions and the lungs expelling carbon dioxide. However, one thing that can go wrong with this process is when the kidneys are no longer functioning properly, either due to disease or there's just too much acid for it to work properly. So this happens when the kidneys are no longer working properly. The pH of the body starts to decrease, and then the bicarbonate within the blood, which is used to buffer out the acid, starts to decrease as well. And in order to get more buffering agent, the bones start leaching bicarbonate. So why is this even important? Why is metabolic acidosis an important thing to know? And the reason for that is because it's usually a secondary condition in terms of a primary condition. So those with chronic kidney disease, so CKD, diabetes, and those who have acidic diets, such as people who are on the keto diet can all get metabolic acidosis. And when metabolic acidosis is long-term, it can cause structural changes in the bone, and therefore it can cause an increase in fractures, which is never good. And to further comment on this point, there was a study that looked at 50,000 patients with chronic kidney disease and compared those with normal levels of bicarbonate within their blood. And they found that people with chronic kidney disease have a higher chance of fractures, falling, and other adverse bone outcomes. So my project was to first evaluate the temporal response of a graded acid loading marine model of metabolic acidosis that our lab, the Damier lab, created, and then compared this new model to a more traditional flat dose model of metabolic acidosis that has been well established in publications. So first, the flat dose model does sometimes a good job of inducing metabolic acidosis, but it does not do well at showing the clinical bone phenotype of metabolic acidosis in humans, while the graded dose that we created, in theory, we hoped that it would do this. It would mimic the bone phenotype, and you started off with a low dosage of ammonium chloride, which is what is also used in the flat dose, and then gradually increased the dose every 3 days. During these various time points, we did blood gas analysis in order to determine blood pH and other blood gas components that are occurring within the mouse. We also looked at Raman spectroscopy so we dissected the femurs at day 0, day 1, day 3, day 7, and day 14. And we looked at Raman spectroscopy to characterize the composition of these femurs. We then did 3-point bend mechanical testing in order to see if maybe modulus, maximum stress, and things in toughness would be changed. And lastly, we looked at the structure of these bones using microcomputed tomography. So first, in order to establish that the mice are in metabolic acidosis, we looked at blood pH, and we found that the flat dose model had this huge decrease in blood pH at day 1, but then it kind of flattened back out back to controls after day 7 and day 14. While we saw this more gradual decrease within our graded dose model in blood pH. Next, we looked at the structure of the bones, in particular the trabecular bone, because this is where a lot of metabolic processes and diseases affect bone, as well as bone regrowth and bone remodeling. So we wanted to see if there are any changes within this area of the bone, and we found that the flat dose did not have anything significant change, but the graded dose did have this significant decrease in the trabecular bone volume compared to the total volume at day 1 and day 3, which is indicative that of a bone dissolution occurring within those first few days. Next, using the Raman spectroscopy data that we got, we looked at the carbonate to phosphate ratio, which these two ions are very important components of the bone mineral. And we found that nothing changed in the flat dose, but that the graded dose had this gradual decrease with a significant decrease at day 14, further showing bone dissolution occurring at the cortical bone. Lastly, we looked at the mechanical properties using 3-point bend testing, and we found that there was no change in the flat dose, yet again with toughness, but we found this very interesting data where there was an increase in toughness from day 1 to day 14 in our graded dose, and we did not think this would occur. We thought maybe a decrease in toughness as well as a decrease in other mechanical properties would change. So we think maybe there might be something occurring with the collagen fibers, which are increasing the toughness of this bone, as well as maybe interactions happening between the bone mineral and the collagen fibers that are causing this reaction. So just to kind of overall conclude everything that happened within these models, we found that our flat dose marine model had a short-term decrease in blood pH, which is more related to acute response of metabolic acidosis, along with the lack of changes within the structure, mechanical properties, and compositional changes or compositional properties. While our graded dose model had more of a chronic response due to the long-term decrease in blood pH, as well as a decrease in the trabecular bone volume and carbonate to phosphate ratio. And interestingly, we also saw this increase in toughness, which we will be looking into further. So our graded dose model is really important because it mimics the deleterious temporally dependent effect of metabolic acidosis on the skeletal system, which is what we wanted to do with this new model. And it will be useful for us in the future as we build upon it by looking at recovery scenarios, such as using bicarbonate as a treatment, which I am currently doing to see if bicarbonate treatment, which is typically used for people who are in metabolic acidosis to help increase their blood pH, if that helps also rebuild their bones after being exposed to acid. We can also use this model to further figure out the mechanisms of bone buffering due to metabolic acidosis, so seeing if what's occurring is more physiochemical processes or if there is a higher influence within cellular behavior, such as osteoclasts and osteoblasts, changing their behavior and seeing why this is occurring. And so our flat dose model seems to be better than the well-established flat dose models, because the flat dose models, as you saw, did not really show much beyond being an acute metabolic acidosis response. So kind of that first day of just quick changes within the blood pH, but not having any effect on the bones. So our graded dose model has been very useful for this chronic metabolic acidosis problem that we're trying to look into. And so I would like to thank you all for listening to my talk, and please come find me on Twitter, Instagram, and LinkedIn. And I'm looking forward to your questions. Thank you.